we'll get started. So good evening, everybody. My name is Carmen Gamina. I'm the superintendent of Webster, and we want to thank you for coming out. This turnout has actually far exceeded our expectations, so this is wonderful. Thank you so much for taking the time away from your families to come and find out some information and become more aware of a community health epidemic. I have learned so much over the last year regarding this topic, and much of what I've learned is actually from Dr. Mendoza, who is one of our panelists and is the Director of Health for Monroe County. And when I know that our minds over the last 7 days or 14 days have been perhaps on other things other than opioid addiction, opioid overdose deaths, and so on, but it still comes down to keeping our families safe and keeping our children safe, no matter how old your children are. And so how do we as a community partner with all of our resources, whether they be law enforcement, medical professionals, first responders, how do we make sure that we're safe, our kids are safe, our neighbors are safe, and obviously our community as well? And we are so lucky to have panelists who, again, are taking time out of their day, not only for tonight, but many of them will be going to other districts tomorrow and on Thursday. And these are the experts. And we're very happy that they're here to share that expertise with us over the next probably 75 minutes. And the way that tonight will unfurl will be, after my opening remarks, I'm going to introduce Mike Molinari, who is the Assistant County Executive, and he'll say a few words, and then we'll have Dr. Mendoza come up and share with us some startling information about opioid overdose information and the epidemic, as he calls it. We will then turn it over to the panel. Each panelist will say a few words, and then we wanted to make sure that we have a significant number of minutes for you to be able to ask questions. And when we get to that part of tonight's agenda, which will happen right around 7 o'clock, 7:10, we have these two mics up here, and also this handheld mic, but you can come on down and ask any panelist or the entire panel your question. So as you are sitting back and reflecting on what you're hearing, if you have a question, feel free to write it down somewhere, not on our tables, but feel free to write it down, and then you can share it with us and our panel later on this evening. So without further ado, I'd like to extend a warm Webster welcome to Mike Molinari, who is our Assistant County Executive. I know that Cheryl Donalfo wanted to be here, but she is on her way back from Dallas visiting her grandchildren. So we'll give her a pass tonight, but next year she'll have to rearrange her schedule to make sure that she can be here in Webster as well. But Mike, if you want to come on up. Thank you. Thanks, Carmen. Thanks.
Thank you, Carmen. Good evening, everybody. Webster, and thank you for joining me here for this important discussion. As Superintendent said, my name is Mike Molinari, and I'm the Assistant County Executive here tonight representing County Executive Cheryl Donalfo, who, again, as Carmen said, is traveling back from Texas after visiting with her grandchildren. However, she would have liked to have been here with all of us. I would like to thank my partner in county government, legislator Matt Terp. I know he's here tonight, and along with Janine Sanger from the Webster School District for their partnership as we discuss one of the most challenging public health crises our nation has ever faced, one that continues to threaten children and families all across America. I also want to thank our panelists tonight, including our Commissioner of Public Health, Dr. Michael Mendoza. Heroin and opioids have taken a heartbreaking human toll in every corner of Monroe County. Our medical examiner's office has determined that over 200 deaths across our 10-county region were directly attributable to the use of heroin, opioids, fentanyl, or other related substances in 2016 alone. We can never lose sight of what those numbers represent: sons and daughters, brothers and sisters, mothers and fathers, and friends and family lost to addiction. Tonight's educational seminar is just one part of County Executive Dinolfo's Monroe County Opioid Action Plan, a wide-ranging approach to this crisis that recognizes the important role that county government can play in the supporting prevention, treatment, recovery, and law enforcement. Why are we here today? Because the sad truth is that everyone knows someone who has been impacted by heroin or an opioid addiction. It can be a student athlete who was prescribed an opiate from a sports injury who ends up getting hooked. It could be the son or daughter who finds an expired prescription in the medicine cabinet, who finds, only to end up transitioning to other, harder drugs. Or it could be any number of everyday families here who have been devastated by this deadly crisis. When the stakes are life and death, inaction is not an option. That's why Monroe County will continue to lead the response to the heroin and opioid epidemic in 2018. County Executive Dinolfo's Opioid Action Plan consists of several components, each intended to tackle a different aspect of the epidemic. Some of these components are already underway, but each one has had and will continue to have an impact on the lives of those infected by heroin and opioids. Fortunately, we have a great foundation to build upon. Monroe County has already taken an aggressive approach to combating the heroin and opioids crisis by invested heavily in awareness, education, and prevention. Representatives from County Executive Dinolfo's administration continue to serve alongside law enforcement, health professionals, and everyday citizens on the Monroe County Heroin and Opioid Task Force. Recently, County Executive Dinolfo asked Dr. Mendoza to convene a brand new advisory panel on opioids, where some of our area's foremost medical experts will share their opinions and suggestions on how we can better improve the system of treatment in our community. The combined expertise of these medical professionals is staggering. We intend to harness their collective knowledge and experience to improve our community's response to this crisis. To have representatives from some of the largest healthcare institutions in our region serving on the same panel for the same cause is an incredible asset to our efforts moving forward. In the past 6 months alone, Monroe County has hosted over a dozen informational seminars like this one this evening in partnership with many of our local schools. Since we launched this program in 2016, we've seen tremendous interest from parents, teachers, and students who attend to hear panelists from the Monroe County Sheriff's Office, the Monroe County Public Health Department, and other agencies who share their insights into what is causing this epidemic and what can be done to prevent and stop it. Many of our outreach efforts incorporate training on the use of Narcan, a safe and effective emergency nasal spray that can be easily administered to stop an opioid overdose. In many cases, Narcan can mean the difference between life and death at a time when seconds count. There will be plenty of opportunity for residents to participate in the future as well. These seminars will typically be held at the Health Department on the fourth Wednesday of every month, with both morning and evening sessions. I'll let Dr. Mendoza get into the specifics during the panel discussion. The old saying goes, an ounce of prevention is worth a pound of cure. There may be no case where that is truer than in the prevention of addiction. I want to thank Dr. Mendoza, Bob Zerby from the Monroe County Medical Examiner's Office, Deputy Mike Vivada from the Sheriff's Office, and all of our panelists who have and continue to make these outreach seminars so impactful. I look forward to hearing your expert insights tonight. Thank you all for being here. Good night.
Thank you, Mike. We'd like to bring up Dr. Mendoza. And Dr. Mendoza is our Commissioner of Public Health, and he's been in that role for a few years. And Dr. Mendoza, you are still a practicing physician as well, where he sees his patients, and that's the first time ever, I think, for Monroe County that we've ever had a commissioner who has kept his or her own practice as well. So which is a wonderful asset for all of us in this community. So thank you again for being here, and we look forward to hearing your presentation.
Thank you. Good evening, everyone. Can you all hear me? Well, again, my name is Dr. Mike Mendoza. I'm the Commissioner of Public Health for Monroe County, and I want to thank all of you for being here tonight. As I look out into this room to see so many people who are engaged and interested in having this difficult conversation, I can think of nothing more optimistic than to know that this will hopefully not be the last conversation, particularly in the school district as well as across the community. I want to acknowledge that this can be a hard topic for a lot of people to hear. And if this talk brings up feelings and emotions of whatever type, know that we're in this together. You know, this community here in Webster is very strong, and I know that the support services available here in this community are very strong, and if you need anything as a result of this presentation, please don't hesitate to reach out. Huh. All right. We'll roll with it. So, for tonight, these are the take-home points that I want to convey to all of you. First of all, I want to convey that addiction is a chronic illness. It's a disease. It's a medical illness. I can't tell you how many times I go out into the community and hear people tell me about how this is a choice or somehow this is a sign of moral or religious failing. Could not be further from the truth. Chronic addiction is an illness, and we need to treat it in that way. And we need to treat the people who suffer from this illness with the respect and the love and the caring that we do with any other medical illness. Second, overdose is preventable. As much as we see in the press and in the media about how overdose has taken over this community, know that it's preventable. Preventable both through Narcan as well as through multiple other educational and preventive efforts that we can undertake in the community. Third, I want to talk a little bit about what we've done, talk a little bit about why we are in this predicament, hopefully as a way of conveying how we can move forward. And finally, I want to send you all home with some homework, thinking about things that you can do in your own lives to help us to get around the problem of opioid addiction and overdose. So do we have any gardeners in the room? What is this? That's right. This is a flower from the poppy plant. It is the origin of opium. Opium traces its roots as a medicinal substance back to the year 3400 BC. And I show this as a reminder that just because something is natural doesn't make it not potentially dangerous. And so I also want to show that the opioid that is available through poppies is what is the root ingredient of morphine, or what we know today as opioids. And so when these substances become active in the body, they have good purposes. They can help us with pain, with a whole host of medical conditions. But unfortunately, they also have a side effect, which is that it induces pleasure in those who take it. And that is the reason why it's become so highly addictive. And in recent years, we've seen a preponderance of even more opioids. And that is the reason why we're seeing this huge spike in overdose-related mortality, because this stuff is so addictive. So on the screen here, I show a PET scan of the brain, human brain. On the far left, is the PET scan of an individual who is not suffering from a drug use disorder, okay? The yellow activity is, brain activity, essentially. The middle picture is the PET scan of an individual who has a cocaine addiction who's gone 10 days without cocaine. And as you can see, there's a markedly different view of brain activity. This underscores the fact that this is a medical illness. The use of cocaine causes changes in our brains. This is not something that people can choose to do. Okay, this is chemistry. This is what an illness looks like, particularly when it's an opioid addiction. And the final picture, which is even more telling, is the picture of an individual's PET scan after they've gone 100 days without cocaine. And as you can see, the image is not quite back to normal. Okay, this underscores the permanence, the difficulty of getting through sobriety and the importance of maintaining addiction support services throughout somebody's recovery. We can't just detox somebody and hope they'll do better, because we got a long way to go to help keep them in recovery. So unfortunately, anybody can become addicted, okay? There are a lot of risk factors for addiction that we cannot control. These are part of our hereditary makeup. This is what we inherit from our parents. It is what predisposes us to addiction. And there's nothing really you can do about that. There is some that you can do about the environment that we grow up in, and that's why it's so important that you all are here, because what we're trying to do is help create as safe as possible an environment for our children. And as much as we can, we want to limit early exposure. We want to do everything we can to help people through addiction so that our kids are not exposed to this early in life. And then we want to do everything we can from a community perspective to, again, decrease the exposure of addiction to our younger residents. Anything we can do to prevent early use is a good thing. So these are data from Monroe County. This comes from our Youth Risk Behavior Survey. This is from the year 2017. And this is a survey of high school students, 9th through 12th grade. And we asked these students, they self-reported, in the past month, how often did you use e-cigarettes, alcohol, binge drink, or marijuana? And as you can see, this is a problem that lives in our community. This is in every district, everywhere across our community. This is an average of all districts. This is something that we can't ignore. This is happening now, and these are the early signs of addiction. Some of it might be dabbling and playing, but these are the roots of addiction, and we have to own this as a community. What's even more striking on the far left is we asked students, have you ever used any of those substances? Heroin use, prescription drugs to get high, and over-the-counter drugs to get high. And as you can see, it's not insignificant there either. So we do have work to do together here in our community. So I don't need to tell you all about the human toll that this has taken on our community. Addiction impacts the lives and the families and the well-being and the day-to-day living of so many people. And it's been around for a long time. It's gotten a lot more attention lately, but this is a chronic problem that just, the human toll is untellable. From an economic standpoint, the dollar value that we lose is also staggering. $120 billion in lost productivity annually, simply from addiction. What's even more telling to me is that 1 in 10 children across the United States is exposed through somebody with whom they live to the problem of addiction. And the majority of these kids are under the age of 5. And so as we think through what are the traumatic experiences that put people at risk for addiction later in life, it's early exposure like this. And so it's so important for us to help our younger residents do what they can to prevent early exposure. So I want to contrast addiction with overdose because, while addiction has been a chronic problem, we're not seeing the increases in addiction like we are seeing the death from overdose. And so addiction is a chronic illness, but the overdose deaths are the epidemic, okay? And so why do we have this overdose epidemic? Well, first of all, it's a very complicated situation, but I will say, as a physician, that I want to point the finger back at us first. Because in the early 2000s, a lot of medical expert bodies started to say, well, we need to make pain the fifth vital sign. We need to identify pain wherever we can and do everything we can to reduce it. The pharmaceutical industry caught on to this and said, well, why not produce more medications to help medical providers achieve that goal? Unfortunately, it wasn't a very good goal, because if you've ever been to a doctor in the last 15 years, you've been asked the question, what's your pain? Can you rate it on a scale of 0 to 10? And if you stop and think about it, my 5 is different from somebody else's 3, is different from somebody else's 9. And we don't know very much about the difference between physical pain and emotional pain, and what does that number really mean? Unfortunately, it created a culture where we made pain the enemy, and we had to do everything we could to reduce it. And that's what got us on to this problem. We, as an industry, produced so many more opioids than we needed, and that's what set us on this path. In the more recent years, in about the recent 10 years, as the medical community has identified the need to reduce overprescription through iStop and other mechanisms, we succeeded largely. We've seen in Monroe County the number of opioid prescriptions go down over the last several years. Unfortunately, we're not seeing the death rate from overdose going down at all. The problem is that while we decreased overproduction and overprescription, we haven't yet done enough with addiction. And so what people are doing is they're shifting from prescription opioids to illicit opioids, the ones you find on the street. And unfortunately, it's those opioids that are far more lethal than OxyContin and Percocet. So I'm going to go through some of the data to hopefully underscore how bad this problem has gotten. On the far left is the number of drug overdoses in 2015. It is greater than HIV and AIDS at its peak, greater than car crashes, gun deaths, gun homicides. And this was in 2015. The numbers have only gone up. On this graph, I show the drug-induced mortality rate over the last 10 years or so. As you can see, it's gone up. It's eclipsed motor vehicle and firearm-related mortality. This is overdose deaths involving opioids by the type of opioid that is implicated in the death. You can maybe see the green line there, that's all opioids. In roughly 2010, you see a spike in heroin. That is almost exactly when most of the efforts in the medical community began to decrease overprescription of opioids. And so as we prescribed fewer opioids, people were turning to the streets for heroin. And more recently, the orange line that you can see there, that's fentanyl. You can see a much more pronounced spike in the last several years, and it's only gone up since then. And when we talk about fentanyl, we're not talking about medical-grade fentanyl that I prescribe in the hospital. This is illicit fentanyl that's dirty, that's coming from other countries, that is highly lethal. Some of these fentanyls are 50 and 100 times more lethal than OxyContin. And if somebody takes one of these fentanyls, it's really a losing battle. From a public health standpoint, this is about the worst news that I can deliver. This is life expectancy over the years. For the last 2 years, life expectancy in the United States has gone down. The last time it went down was in the 90s during the HIV and AIDS epidemic. So this is 2 straight years where life expectancy has gone down in the United States. And every expert that I've read about, talked about, attributes this to the opioid epidemic. This is to underscore that this problem obeys no demographic boundaries. This is a problem that affects whites and blacks, urban and suburban and rural, men and women and kids. The average age of the victims from the opioid overdose in Monroe County last year was 35. Okay, that's young. Well, it's young to me. And then this is a graph that you can maybe not make out, but the one bar that you can see is the United States. This is per capita opioid prescribing. And if this was the Winter Olympics medal count, we'd be proud of it. Unfortunately, it's not. The United States is far and away the number 1, and Canada right here is number 2. And we're a good bit ahead of Canada. And this is the amount of opioids that we've prescribed per capita in the United States. So with this, you would hope that we were at least doing some good with regard to pain, but unfortunately we're not. So as you can see in this graph, the number of people who report pain in good control has gone down over the years. So for all of the prescriptions that we've been writing for pain medications, we're not even doing a good job with controlling pain. So we've got our work cut out for us in this regard. This is a graph that I made using data from the CDC that was released this past July. And I show this data to underscore that it's not just a problem of prescription opioids. So in this graph, I've shown all of the counties in New York State along the bottom. The orange line is per capita opioid prescription in that county. And so as you can see on the far left, there are some counties that prescribe a whole lot more opioids than the counties on the far right. And the blue bars show opioid-related overdose mortality. So as you can see, there really is very little correlation between the burden of opioids prescribed and the overdose-related mortality in that county. So Monroe County is roughly here. Where is it? Right around there somewhere. And we're in the bottom third, which is great. You know, we're doing pretty well from a prescription standpoint, but we're right in the middle as far as opioid overdose-related mortality. And so it's not a perfect correlation. And I think this underscores the reality that it's not prescription opioids that are really the problem right now. We're talking about the lethal synthetic fentanyls that are really causing the problem. So these are the data that you all know by now. This is the overdose-related mortality here in Monroe County. In the year 2016, we had 169 deaths. That's up from 69 the year prior. We're still working through the data from last year, but by every count, it's going to be greater than in the previous year. And so why do we want to focus on overdose? You know, we need to focus on addiction. Addiction is so important. It's a chronic illness. But like I said earlier, we're not seeing spikes in addiction like we are seeing spikes in overdose-related death. The reason why I want to focus on overdose is because if we don't do anything about overdose, this problem is only going to get worse. In the Finger Lakes region, we've seen a threefold increase in ER visits related to opioids from the year 2005 to 2016. Threefold increase in our ERs, and by and large, we haven't added any more ERs to this community. The other reason why I want to focus on overdose victims is because they're an audience of people that really could benefit most from the help. Okay, when somebody comes to the hospital, either the ER or the wards, for an opioid-related overdose, they have a 41% chance of coming back to the hospital within 3 months. Okay, so they are a captive audience. We want to try to support these individuals, to try to get them the support they need so that when they come back to the hospital, they don't leave dead. And as you can see, the readmission rate for 3 months is 9% for an opioid overdose. So if you come in with one overdose, your chances of coming back in 3 months with the same thing is 9%. And so we need to work on the risk factors for overdose. Okay, as much as we want to work on addiction, we also need to pay attention to the risk factors for overdose. And I've highlighted in red the #1 risk factor, which is mixing multiple substances. Right now it's fentanyl, tomorrow it might be carfentanil, who knows? But the reality is that when you don't know what you're taking, you have a much lower chance of surviving. Using alone is another risk factor. The third point here, underscoring the importance of looking beyond just detox beds. If we can help somebody through the detox phase, but we haven't helped them with addiction, they actually have a higher chance of having an overdose if they relapse, because they've lost the tolerance that they had prior to going into detox. And so we can't just focus on detox beds. We've got to do a very comprehensive approach to addiction here. When users switch from one source to another, that typically means from one dealer to another, they have a higher chance of overdosing because they don't know what they're taking. And then other related mental health disorders and physical disorders also put somebody at greater risk for dying from an overdose. So the Assistant County Executive summarized some of the points that are part of Cheryl D'Onofrio's comprehensive opioid action plan. What I want to say about this is that, you know, I think we are very fortunate in this community to have a comprehensive approach to opioids. I talked to my counterparts across the country, and they wish they had it as good as we have it here in Monroe County. which isn't to say that we don't have a long way to go, but I do think, and I am very proud that we've got this head start on this epidemic, and we've got to keep working at it, we've got to keep collaborating across our community, but I think we're very fortunate to have the support of the community as well as government and others. So this is my homework for all of you. First of all, I want you all to raise your awareness about this problem. Please try to understand that this is a disease. This is an illness. This is not a choice. People don't wake up one morning saying, I want to have an addiction, and they can't wake up another morning and say, I want to be cured. It just doesn't work that way. This is an illness, and we need to support the people who struggle with this illness with the compassion and love and support that we have for all other illnesses. Next, I want you to go home and look in your medicine cabinet. Look for drugs that you are not needing, whether it's high blood pressure medicines or cholesterol medications or opioids. If you don't need it, it's only going to cause a problem down the road. And it's particularly true for opioids because somebody might come across these medications and inadvertently take them or take them intentionally and become addicted. And then we've not done anything to help the problem. So please go home, dispose of unused medications, and particularly the opioids. I hope this isn't the last conversation. I hope we'll continue to have this conversation both here in this community and other communities. I think awareness only can lead to better awareness. Go home and think about whether you want to have Narcan in your home, and think about whether you would benefit from having Narcan in your workplace or in your church or at the swimming pool or in the restaurants in our community. Narcan is 100% safe and effective, and it is the antidote to somebody who is undergoing an opioid overdose. Finally, if you are somebody who is struggling through addiction, please consider getting help. We are here to help you. You've got doctors and an incredible medical profession here in this community that is waiting to help you, so please get help. And finally, again, I want to emphasize addiction is a chronic illness and overdose is preventable. Thank you.
Before introducing our panel participants, I just want to say a few words about when. My name is Janine Sanger. I'm the coordinator of health and wellness for Webster School District and also the president of the Webster Health and Education Network, our drug-free community coalition. And we have our mission printed on the back of your program. So I want you to have a look at that. And also we have our upcoming Drug Take Back Day information. When we did our Take Back Day in cooperation with the town of Webster and the Webster Police Department in the fall, we collected 710 pounds of unused medication. That is significant. Think about what is now not on the streets. So we're doing that again in April in cooperation with the town and the police department. We also host Narcan trainings. We are running our third training this March, right in the middle of March. We have filled up each one of our trainings, 50 people each. We will continue to host those trainings, so if you look at the WEN website, if you're interested in being trained to administer Narcan, I encourage you to come. It's free, and you will leave with your own kit, okay? Last thing is, there are a whole bunch of resources on that table over there, and there are t-shirts, WEN t-shirts, that are free. So advertise for us, this wonderful coalition. Please go and take one and help yourself to those resources. So I'm going to introduce our panel participants. I'm just going to say their names. I'm going to let them introduce themselves and talk a little bit about why they're here and why they're passionate about this cause. We have Deputy Michael Favada, Officer David Hurley, Jason Teller, Shayna Verdine, Robin Whitaker, and Robert Zerby. If you would start on this end and move down with your introduction and comments, that would be great. And then we're going to host Q&A after that. Thanks, everybody. You should be mic'd right there if you just want to stay there. It's up to you. All right.
So I'm Deputy Mike Favada with the Monroe County Sheriff's Office. I'm currently assigned to the Monroe County Sheriff's Office Opioid Task Force. And our task force has two roles, enforcement and also prevention and helping people get resources. When we have an overdose, one of us responds to that scene, and we basically help in the investigation. We'll start talking to the families or whoever else is involved in that, and basically build that intel to find out who the dealers are. We take that information back and we instantly go to work on it. Every morning at 8:45, with our team, we meet, we go through everything that happened the night before. We review what cases that we're going to take, what are priorities, and basically run with that. It's been, in the last month, we have already done, I believe we have already 3 arrests. I know it doesn't sound like a lot, but we're at street level deals. We're out there doing buys. We're doing a lot of proactive police work along with the guys on the road. And this Monday, or coming Monday, is the first event that we are holding in the Monroe County Sheriff's Office. And what this event is going to be is an actual resource for people, for addicts and families. I have the Rochester Regional Health coming, and his name is Richard Caruso. And Richard is going to be there to help us get beds for people when they come in. That's the biggest problem. We don't have enough beds. So what this event's going to be is they come in, they instantly get hooked up with David Caruso and Richard Caruso, and they'll be transported to wherever the bed is available for them so they can get immediate treatment. We're also going to have education, people from education there from the DePaul group. So if families want to come in and sit down and ask questions about whatever is on their mind, we're going to have that resource there as well. Along with, we're going to have Rebecca Baker from SOARS. She's a fantastic resource, and David Attridge as well. They're going to be on hand. But the point of this event is to have the resources in place. You know, when somebody comes in, they get what they need. It's instant treatment. If they get shipped out of there, they're getting a bed, they're getting the help that they need. They actually, once they get down to the hospital, they'll actually have somebody helping them set up for health insurance. That was another issue that I found in the last month of just putting together a team of people to help everyone in our community. And the other thing is too, with what's unique about my position is that if there's a parent that finds drug paraphernalia in the house, they're afraid to call the police. They don't want their child to get arrested. I mean, I get it. I have gone out to more houses in the districts that I cover on the east side, met with the families. I take the paraphernalia, no paperwork, nobody's getting in trouble, but let's find out why this kid has this. I don't want to get arrest your child and build that, that distrust with the police thinking they made a mistake, and they got to pay the consequences for it right away. So I'll go there and meet with the families, and we'll get the kids set up with the right people to get them help along with the families, and we'll get rid of the drugs. I think it's important. It's worked well. And really, again, the cooperation we have with all the other departments, the information sharing is fantastic. Our team, we work right out of, basically we call it our war room downtown. We're with the feds, with Granite. So we work with federal agencies, local agencies, and state. So anything that we can't do at our level, it automatically gets turned over right to our Granite, and they'll run with the investigation. But this task force is, so far in a month, we've made some great headway, and we're going to continue to do these events and on the west side of the county. And I know that we have 3 more set up just on the east side, again, for people to come in and get immediate help. That's a big thing. So any questions for me after everybody's done? I'll take your questions. Have a good day.
My name's Officer David Hurley. I'm with the Webster Police Department. I'm the school resource officer for the Webster Central School District. I'm afraid that if I get up, I'll walk all over the place, and I don't want to be up there too long. I love my job. It's been an awesome opportunity the last few years with a great thinking of Mr. Gamina, the superintendent, and Mr. Nesbitt, the town supervisor, to create the school resource officer position, them working together to fund this position. I value the R in that, the resource part. I'm a resource for the district, for the students, for the faculty and staff, and for the family members. I'm not there to police the school. I have done police work in the school, but I'm there mostly as a resource for faculty, staff, and students, and I enjoy that. Like Michael said, I think the key is prevention, and I would hope that a lot of my work is preventing some overdoses and addictions later on. And I hope to continue to do that for the next few years. I'll take questions afterwards.
Hi, my name is Jason Teller. I'm the substance use specialist with the Monroe County Office of Mental Health. I've been in that position now for almost 2 years, and I've been working in the field of substance use and recovery for the last 15 years, essentially since I graduated college. And in my current role, I am the planner as well as the assistant to any organization in substance use and recovery providing. So I convene a substance use providers meeting monthly with all of the Monroe County providers, as well as attend all the regional meetings that I can. I'm also a Webster resident, and I've been a part of the Webster coalition now with Janine for the last year and a half. My job really is focused on identifying gaps in the community, making sure the community's needs are getting met, and working with providers through other transitions, whether it be regulatory transitions and such. Really what I'm hoping to deliver the message of today is that there really is more help out there than maybe is perceived, that there really is a lot of hope for people that may have needs. Locally, as Mike mentioned, we really do have quite a few resources, and you've heard about some of them: Gates to Recovery, Recovery Fitness, Becky Baker's group SOARS. So we really do have a lot of assets in our community, and getting connected to those assets is one of my roles, and I'd be glad to help any family that may need help accessing those. Really also supporting families, recognizing, like Dr. Mendoza mentioned, that this is a family illness, it's a disease like any other, and that when you know a family that's suffering, to treat them with the dignity and respect that you would if a family member was suffering from anything else, and avoid parent shaming and things like that. Just a brief announcement that there locally, we may have read in the papers today or some articles that there's a local agency, Villa of Hope, that was awarded 18 new detox beds that will be provided in our community. At some point in the next few months, I would imagine they should be opening, so that really is some progress. So, and it almost doubles our capacity for that. So I'd be glad to take any questions. My expertise is basically resource availability in the community and resources in the community, and anything recovery related you may have questions about. So thanks for having me.
My name is Shayna Verdine. I am a licensed clinical social worker, and I have a practice in the community. I also work as a family therapist and an outpatient chemical dependency program in the area. How I would describe what I do is I'm a supporter, educator, counselor, come alongside people who have substance use disorders, or if you love someone who has a substance use disorder. And some of my role involves working with families on how to talk with someone who has an addiction. It can be a really chaotic and terrifying time. So how to have those conversations, how to set boundaries, how to take care of yourself in response to loving someone with an addiction or having an addiction yourself, and noticing red flags and education on the disease of addiction. I want to thank everyone for having me here tonight, and I hope that this is educational and beneficial. Thanks.
Hello, I'm Robin Whitaker. My son Jordan Levitt passed away 39 weeks ago today. And so I'm here mainly to answer any question you have. None of them are too personal. I thank all of you guys for being here, for having us here, but also for you taking your time out to get here, because if you have questions that you don't feel you can answer, or you just think they're stupid, they're not. Everything we can do to help so that none of you are in my situation, I'm all for. If my son's death can help one of you or your neighbors or whomever, not have that situation, then everybody has won here at this table. So please, when you're doing questions tonight, we all want to answer your questions. And I just invite you to the microphone. I also sit on the Drug-Free Community Coalition also, so been involved with Janine, and that's a great program. There are so many, like Jason said, there are so many good programs here, and really, we are super lucky to have the opportunity, but thank you for having me, and again, please, any question.
Good evening. My name is Bob Zerby, and I'm the Chief Investigator with the Monroe County Medical Examiner's Office. Just a couple things I want to share with you right now. First off, if you've made it to our office, it's relatively too late. And the best way to avoid coming to our office is, again, let's get over the stigma. Nobody cares. If you're dead, you're dead. There's no better dead, less dead, worse dead, more dead. You're dead. It's cold, but that's the way it is. And many of the people we see don't have to be seen. Go out, get the help, take the time. If you're afraid of it, there's so many people in the same boat as you. I'm not necessarily sure where the fear comes from, but advocate for yourself. You are the only one who will advocate for yourself. And if you have someone with addiction in the family, you're going to have to buckle up and do the work for two, because they're having a deficit, they're sick. And again, there's nothing wrong with being sick. What's wrong is when you ignore it and you actually let it go on to the worst case scenario. Second, this is kind of anecdotal based on what we see very often. As Dr. Mendoza mentioned, in a lot of cases, the people who have the addiction more or less have been led there by the healthcare profession. You've essentially been told that if the doctor says do this, you do this. That's great, but remember, with doctors, there's also options. And if a doctor makes a suggestion to you that you should take some kind of medication, clarify, ask if there's an alternative, particularly if it's one of these big gun things. Face it, if you've gotten kind of old like me, you recognize life hurts. It's painful. You're going to wake up and you're going to be sore and you're going to have a bad day, and way too quick everyone just wants to pop a pill or smoke some marijuana or drink a beer or even have a cigarette. All of those things are crutches, and the pain's still going to be there. And in some cases, what comes after the pain is even worse. So again, kick the stigma. At this point, the only one that really cares anymore is you, because the people here are willing to help you regardless of who you are, where you came from, what you bring to the table, because none of that matters. Again, it's about you taking care of yourself.
So for the next approximately 30 minutes, we're going to invite you up to, there will be 3 spots. We have a microphone right in front of the panel, a microphone right behind me, and I'm going to move one up into the middle row there. So, and before we open it up for questions, we have Chief Joe Rieger is in the very back, and Legislator Matt Terp are in the back as well. And without their efforts, tonight's forum really doesn't happen. And we are incredibly lucky in Webster to have our own police department led by Chief Rieger, as well as having our own school resource officer, and Officer Hurley is incredible resource for our kids and for our adults as well. So before we move forward, thank you, Legislator Terp, Chief Rieger, and Officer Hurley. So we'll open it up for questions now.
Hi, thank you all very much for coming here tonight. I wanted to ask, Dr. Mendoza had mentioned that 41% of people come back to the hospital after an overdose and that they're kind of a captive audience there. What can you do to help them when they come back?
So as part of my work at the advisory panel, I've been working very closely with the chairs of emergency medicine at both of our hospital systems. And I've learned that it's not as simple as it should be. One of the most simple interventions that we can take is to ensure that anybody who comes in with a non-fatal or overdose or an opioid-related complication, we ought to ensure that everybody goes home with Narcan. And through a variety of regulations, some internal, some statewide, it's not that simple. The hospital cannot dispense Narcan from the emergency room. They have to go to a pharmacy. And as our ER colleagues tell us, most people who come into the emergency room for opioid-related complications don't come in during normal business hours. And so it's a barrier that, frankly, we ought to be able to fix. And so I'm working with directors of pharmacy at both the hospital systems to understand, are there ways around that? You know, there are rules and regs that we can advocate for changing. But in the short term, one proposal I have is to take the opioid overdose prevention program that I've begun at the health department and see if we can set up a way to distribute Narcan from me to anybody who comes into the ER from an overdose. It sounds simple, but you'd be surprised. And so that would be a simple thing that we can do, because we know that if they have a 41% chance of coming back to the ER and a 9% chance of having another overdose, it's only a matter of time before we can start preventing them by giving them Narcan in the ER.
Thank you very much.
This is for Robin. Thank you for coming. Are there any warning signs or anything that we should be looking at as parents? Anything that you can think of in just general terms?
Definitely a lot of warning signs that you can pick up. My son was 32 when he passed away, so he was not living in my home. And he was a victim of a work injury, and he was prescribed Oxycontin. And when workman's comp was done, so was his medical care. If I would have to summarize things that I noticed, even because we're a very close family, even with him not living in my home, there were things like jobs that he wouldn't go for because they would drug test there, but I wouldn't know that. I would just think, why isn't he going for that job? I just told him this is a great job he could have, and he wouldn't do that. He just stuck with delivering pizzas. And there are things that, sweating, if you see your child sweating a lot, he'd be still wearing a sweatshirt, and I'd be like, why are you sweating? Why are you sweating? Illness, all of a sudden he was sick a lot. And he hid a fair amount of this, not because of shame, but because they do love you. They love you very much, and they don't want to hurt you, and they know that their behavior is not them. You have to learn to separate their behavior from their addiction. So their addiction behavior is one, and they're still your loving kid that you absolutely adore, and they don't want to hurt you. So they will lie to you. They will also steal from you. And it may not be big things. You might all of a sudden just be missing some small electronic thing, or jewelry that maybe you didn't wear for a while, and then you go to get it and it's gone and you think you've misplaced it. So there's a strong possibility that things like that can happen. So if you see a change in behavior from your child, it's, don't automatically jump to the fact that it could be a heroin epidemic for them. They could just be having some mental health issues. There's a lot of mental health problems. When he was hurt, he got a little bit of a depression because his hand was never the same. So the depression only helped move that addiction further. So those are just some simple signs. Obviously, everybody manifests things differently, but yeah, he still seemed like a good kid, and he actually died. He was to graduate from Unity Health that morning at 10 a.m. And in his list of things to do, one of them said, use one more time, but don't get hooked. And what he chose to do symbolically, maybe because the night before his graduation, 2 of his friends had been lost in the year, 1 2 weeks prior, 2 overdoses also. He went out, had his clothes all set out, everything ready to go, and he purchased something used, and it was total fentanyl. It dropped him instantly, like instantly. And we have a sad situation, and I don't know how to work with this, but there are entrepreneurs out there who will sell fake urine so that your children who are going to get screened, oh, it looks like they're clean. They're not. He actually had a box of that because he knew he would be screened going in for his last visit at Unity. So it's sad all around, but signs like that just tons. I'm sure the panel can share many, many stories beyond what I'm telling you.
Hi. I just have a quick question. Do policemen and firefighters and teachers have Narcan on them in the car at all times?
We have, 2 doses of Narcan. Every police officer does. And if I'll speak for the EMS, I know the paramedics in town, NEQ, West Webster, and Webster EMS all carry Narcan. And Janine can answer if Narcan's at the nurses. I'm not sure about that. There you go.
Yeah, I wonder. They do have it at school too. Yeah, so you never know.
Yeah, I think Chief Rieger put out a press release actually today regarding the use of Webster Police Narcan since just October. Thank you for your question.
Hello. Hi, Officer Hurley. My son, his name's Curtis Warren. You may have noticed me standing on the corner of Main and 250 in Webster. When someone in our community, our county passes, and we hear about it through Facebook, through friends, and kids in our high schools, Thomas and Schrader posting, can't believe I lost my best friend. And that was my son, May 2015. It was nice to see Officer Hurley tonight because I would think of him as my son's personal police officer. Knocks on the door and phone calls, checking on him. It was a hard fact, but a regular time in our lives when my son was young and smoking marijuana in school and doing acid and things like that. It was after high school that he started using heroin, and my son would say, I live on Main Street in the village of Webster, next door to the old Burger King. My son would say to me, Mom, all I want to do is smoke some weed. I just need to calm down, anxiety, relax. I can't deal with this. And I'm like, Kurt, I can't enable you. I can't, give you that $40 so you can go get some weed. He goes, you don't understand, Mom. I could walk out the front door right now and get heroin for free. That's Webster, Main Street, 2015. That was the reality in our lives at the time. Someone asked about signs. Take the signs seriously. I tell people when I stand on the corner, you have an idea in your gut that your kid's using. You have an idea if it's weed, if you smell something. Don't think it's a cigarette. Don't think it was his friend. Just a woof of air flew through. Ask the questions, talk, ask the questions, have that communication. Go through their diaries, do what you have to do. Check the computer, check the cell phone. You know what? You brought the kid into the world. It's your responsibility. Show your love for him or her, making sure that they stay alive. When your kid goes upstairs and they go to bed, open the damn door and make sure that they're still breathing. So what if you have to get up from your show every other hour? Just go upstairs and make sure they're alive. So many of them die home alone. Don't be like me and walk in and see what I saw. I only have one question for the panel, and it's Chief Medical Examiner Bob Zerby. I never got my son's death certificate, and I wondered if you could make that happen for me. Thank you.
Hello, I'm going to follow Kathy Warren's presentation. My name is Janet Schoenberger, and my granddaughter Maya Colombo died last year. She died from an overdose on fentanyl. She was a recent graduate of R.L. Thomas. There's ferocious pain and overwhelming loss that our family feels. And I thank you tonight for being here. I stand with Kathy now whenever anyone in the community, we hear of somebody. And it seems like we're hearing more and more every week, overdoses everywhere. And I want to thank the Webster Police Department for them coming to our house and supporting us. I can't explain to you the emotion that I felt that day, but I can tell you that these two men from the police department that came were the most genuine, compassionate people that I've met in a long time, and I thank you for that. I can't imagine the pain that they suffered in having to tell parents and grandparents that the child was gone, and the emotional turmoil that they must be suffering as a result of those kinds of things. I have a couple of questions, a lot of them, as a matter of fact. I had to write them down because I get kind of emotional about this. I'm beginning to see a shift in catching and prosecuting drug dealers who knowingly sell drugs of death. They're starting to recognize this. I've heard more are being caught in the Gates area. Is that true? And what are we doing here in the Webster area? And specifically, is there a police policy here to dust for fingerprints on the heroin bags if you come upon somebody who has OD'd? Is that a policy? Is that something that can be done?
That can be. It's difficult getting fingerprints in general. It's difficult getting fingerprints on something so small, also of which many hands may have touched. And some of these folks that have touched that, like, was your daughter ever arrested before that?
My granddaughter,
I'm sorry.
No.
So her fingerprints
She was
wouldn't have been
alone
on.
when she died. She was alone. The bags were there and they were never dusted. I know, resources. We don't have resources probably for investigators in every small town.
No, but we are working with, and Michael's.
Shouldn't there be policy everywhere in the United States that they automatically dust for fingerprints when they come upon somebody who's OD'd? Shouldn't that be policy?
Well, I think we can. There's a lot more that can be told by the drugs than we can't necessarily from the fingerprints. Because like I said, the fingerprints might be very difficult to get from the bag or whichever way it was delivered.
Mm-hmm.
But the drug information itself, the chemical breakdown, Mr. Zerb, you could, well, that's what he used to do at the forensic lab, was to actually find out the chemical breakdown of the drugs and find out where they're coming from and which dealers dealing what. And Michael will talk a little bit more about the task force and what they do.
Okay. Does the Monroe County Sheriff's Office become involved in the, if there is an overdose in Webster or a small town?
We'll come if they ask us to come in. Webster is very capable of handling their own investigations. If they need our assistance, we're there for them. But again, they have great investigators, and obviously the police work they do is great. So when it comes to the scene, there are only some things that we can disclose, just because we don't want what we've been doing in the last month or two, what we've changed with new ways of gathering intel. But like I said, you saw Gates has made several arrests where they've actually put criminal negligent homicide charges on these dealers. And that's what we're targeting right now. We're looking, and the message out there. I mean, we work with several different CIs who say, yeah, they know you're coming after them now for this homicide charge, which is fantastic. I mean, that's what we want. We want to get that message out there. And one of the things, too, is we're trying to kind of retract the amount of information we put out when it comes to overdoses, because we noticed when we started putting that out there, they came in. More came in from outside because they heard the product was good. If people are overdosing, they want that product. They want to know what that is. So we don't put out everything that we're doing just because we're trying to obviously curb this.
I understand.
Well, like you said, the information that they gather every morning, that's from not only the Webster Police Department, that's from all local law enforcement agencies working together, because the drugs might be sold in the city. The person might live in Penfield, and the overdose might have occurred in Webster, or might have occurred in Brockport. So it's definitely a Monroe County issue that we're working to, and we have to work together.
To give you an example, we had a overdose death in Penfield 3 weeks ago.
Right.
I went and met with the family, and within a half hour of that meeting, we had already identified who that person was. That's how quickly we're moving with this task force. So we are now on to that particular who that person was, who she had contact with prior to her death. So it's, again, the information sharing that we're doing, the way we're gathering intel, it's a work in progress. It's brand new for us, but it seems to be working very well.
It's better. It's with
Yes.
every year, it's better. What can the average citizen do to change the DA's policy of plea deals for drug dealers?
I missed the last part of it.
How can we, the average citizen, promote, I don't know how to say it, to get the DA not to give so many plea deals to drug dealers? Is that the golden,
kind of out of
that's
our
the golden
wheelhouse.
question?
Yeah, that's, that we.
I mean, where does
we arrested-
Todd Baxter stand on this issue? Is he in favor of getting rid of plea deals for drug dealers who are killing our children?
I mean, you can ask anybody in law enforcement on our level, and we're going to say we want all of them away forever. You know, it's hands down, but that's way out of our control. I mean, we turn that package over to the courts, and it goes from there. I mean, we go in and testify, but when it comes to the actual charges, I mean, I don't really have. I wish I had an answer for you. We don't on that end, but no, we agree.
Okay, thank you.
One suggestion I would give you is that on March 6th is Advocacy Day in Albany, New York, and it's Recovery Advocacy Day, so that's where private citizens that have been, typically private citizens that have been directly impacted by substance use disorders. Last year there was over 1,000 people there, and they expect more this year, so they march on to Albany and then go meet with their policymakers that they schedule meetings with, typically in larger groups, depending on your area. So, I mean, what you're speaking of sounds more of like a regulatory and policy issue. So starting at that state level is where some people are trying to initiate the changes. And this year there's a bus going from Rochester from 3 separate locations and picking up family members, and Recovery Fitness and a variety of other organizations are managing that operation. If you're interested, they have a Facebook page, and they'd be glad to have you on their bus. So
Okay.
there are other parents and such that are impacted by, and grandparents. So.
Okay, thank you. Can I keep going? I've got a couple more. I know I want to get into the medical. I thank Dr. Mendoza for speaking about we need a
Ms. Schoenberger?
Yes.
Could I
sure,
just
sure.
interrupt you for 1 second? I just maybe open it up to a few more, and then if there's time, we'll get to your next couple of questions. Is that okay? Thanks.
Good evening. Thank you for being here. I got a two-part question. One might be real basic. I know in the past we've had an undercover officer from the city come out to some various things in Webster, and he's used to be a narcotic agent and do undercover buys and things like that. And one of the things I asked him at one of our last sessions on Superintendent's Day is like, and this might be way above anyone's expertise here, but it seems like that the majority of opium comes from overseas. And wouldn't it make sense that as a government and like I said, this might be way out there, that we bombed the opium fields in Afghanistan, and I know that has happened recently. And it's probably not something that's in the news, but it just seems to me like you kind of cut off the source, and that would help. And I'm not trying to be insensitive at all. That's not.
I like your thinking.
It doesn't make sense to me why we don't do that. I don't know. But that's one thing, so I just kind of like get someone's opinions on that. And I guess another question is, how do you help someone that you may perceive, and I'll be honest, I may have a family member, a niece of mine, that has some issues, and, of course she denies it. And, like, how do you help someone that you know there might be something going on and they just pull away, and you don't, I guess, if you approach them too hard, they pull away and retreat, and then it's even harder to talk to them? Like, what's the expert opinion on how you approach someone that may have a problem and what you do to get them help? Thank you.
I guess how I would answer that is continue to pursue them. I think it can be very easy to be defensive in response to their defensiveness. Dr. Mendoza talked about making sure that we're showing love and really approaching them not from an attacking, condemning standpoint. I heard you say like that person will kind of pull back and retreat, and that's that defensiveness, probably part of trying to protect what's going on and hiding what's going on to a degree, maybe to protect you as well. I think too, interventions are always an option as well. Come together without attacking and encouraging this person to get help and support. And I know on the back table there's a list of resources and treatment centers that are available. It's not just a one-time conversation probably that you're seeing. And if you can think about boundaries that you can establish, making sure that you're not giving money, looking at boundaries that you can set in that relationship.
I'll take the first part of your question, which is the question of supply. What we know from science is that addiction is a demand situation, and we need to do everything we can to control the addiction, thereby reducing the demand. Because if there's no demand, then it doesn't matter how much supply there is. And to your suggestion, while I think it's well-intentioned, the reality is that the vast majority of fentanyls that are coming into this country are not grown in fields. They're produced in laboratories. And these are secret, covert laboratories that nobody can find easily. And I wish it was an easy demand-supply imbalance that we could just simply fix. But the reality is that we really have to work on the demand side of things here and reduce the demand so that we don't have to worry about the supply.
Just to address your second question as well, there are a multitude of peer programs that would be glad to help any family try to have a conversation with their family member that may be suffering. And I think that's the language that we're trying to encourage people to use. In the past, they used to say, I'm going to confront someone about their addiction. That automatically creates a different dynamic that you don't necessarily want to have in a situation where you're trying to induce change. And really, it's about having a conversation. There's peer programs. The county actually funds a program called Recovery Support Navigator that has information back there where literally it is a family member that has gone through a similar thing that helps a family navigate the challenges of how you deal with a family member that's suffering.
Hi, my name is Karen Wheaton. I've been going through this with my son for about 7 years, and he is in recovery. My question is for Dr. Mendoza and Jason. With the emergency room, when a patient comes in and they've clearly overdosed and have been given Narcan through the first responders, my son was sent home with a sheet of paper. This was a couple of years ago. And my question is, what is being done at this point in the emergency room to change those policies?
Well, I'm sorry that that happened. I'm glad to report that things have progressed substantially since those days. My colleagues in the ER very well recognize that we need to do a better job than simply to send people home with paper and a prayer. The issue, though, is that we need to develop capacity for the services that come downstream. And when I talk to my ER colleagues, the people that come in an overdose situation are sometimes the people who are least ready to seek help. And so, recommending a detox bed from that point is, by most accounts, not adequate. What my ER colleagues tell me is that they want these individuals to land in a primary care setting where they can begin the process of recovery and get through the acute phase of their addiction. And that's what we're working on, is developing the capacity within primary care. And so one of the largest undertakings in our community is to expand access to medication-assisted treatment. How can we expand that, recognizing that it takes a few additional hours of training and a fair bit of coordination across our system? That is my goal, is to establish greater capacity for medication-assisted treatment in primary care, because that's ultimately what's going to help people find long-term recovery.
What about having a peer mediator or social worker talking to these patients?
So Rochester Regional Hospital does have a peer that's embedded in the hospital during business hours now from the Recovery Support Navigator team. And so they're there during business hours, but they are available during non-business hours as well to the hospital. And we're working on getting someone there at the Strong Hospital emergency room as well. But like Dr. Mendoza is saying, it's the aftercare availability that is what we need to broaden, what we need to expand. And just so folks know, I mean, if you're getting discharge planning like you unfortunately did a couple years ago, that's against the law now. So as of last year, Governor, at least against New York state law, it's a hospital or any emergency requirement by law that they have a comprehensive discharge plan upon discharge from that hospital. That is a law. Now, again, I'm pushing back on the Recovery Advocacy Day. I mean, these are laws that, we can talk about the local challenges that we're having, but many of them are regulatory issues, and many of them start at the state level and what, could be issued at the state level. So there are opportunities to advocate for yourself and your families. Like I said, March 6th is the Advocacy Day that exists in New York State at least. But so if those things happen, it is your not necessarily responsibility, but you're right at least to confront them that this is not an appropriate plan. I mean, I work closely with a woman whose son is unfortunately dead now due to overdose, and his discharge plan literally said, do not do drugs. That was what was written in that plan. And again, that was 4 years ago, so thankfully that's not happening anymore. But when those kinds of things happen, it's our responsibility to make sure we're confronting those entities that are not doing what is required by law. So.
Well, I did want to commend everyone for being here. There have been so many new resources for parents, for people struggling with substance abuse. Amazing in the past 2 years, and I thank you all.
So we have about 4 more minutes, maybe a couple more questions if you'd like to ask. Go ahead.
Hi, my name is Carrie. I'm a recovering opiate addict, and I just had 2 questions. One was for you at the end, police officer. You said something about the beds, to come in and get beds. When was that?
We did with Rochester Regional Health, and his name is Richard Caruso. He's a chemical dependency director. And we met with him, and he said that at times they have approximately 4 to 6 beds available that he can get throughout the county, if not go outside of the county. So what we did was we set up an event that's just Monday, so people can come in and get that treatment right away. So immediately get transported down to one of those beds to get help. That's and obviously they heard him talk about they're bringing more beds into the county with the next couple of months. I think he said about 18 to 20 beds or so, which is huge. I mean, that's just what we need. But again, at any time these beds are full, these people leave, it opens up that bed, so people that are on a waiting list will get called and they can come in and get help. But we're trying to streamline that and make it where somebody can come in. And again, we don't care about arrest if they have warrants. We're not IDing anybody. Just because law enforcement doesn't mean that we're enforcing any laws. We just want to get people in there and get them help.
Okay. And my second question was, Narcan doesn't always save lives, correct? Or overdoses. They don't always come back from an overdose with Narcan, correct?
Narcan only is effective for opioid-related overdoses. So
No,
if it's,
that's what I'm talking about. It doesn't always.
it won't always work. If there's a delay, if the power of the opioid is too strong for the available Narcan, it will not work. But it's the best hope we have, and so as much as we can, we want to take advantage of it.
Okay. Thank you very much.
Hi, I have a question for Dr. Mendoza. I'm a foster parent in Monroe County, and caseworkers tell me that many of the children coming into foster care these days, it mostly is due to the opioid epidemic. So what recommendations would you have for raising a child that was born with drugs in their system to drug-addicted parents?
My advice for that family would be the same for any other family, which is to ensure that there's a strong connection to primary care health care, to ensure that we can meet the preventive needs for that child. And in this instance, I think it's really important to pay attention to the impact of adverse child events or the trauma. You know, I think those micro traumas are even more pronounced in children who experience foster care, and I think they deserve a higher level of primary care. And as you probably know, Starlight Pediatrics at the county is our primary care home for the foster care system. And that's part of the health department. I oversee that office. And we do everything we can to provide trauma-informed care to all those kids and all those families.
Okay, thank you.
Thank you, everybody. One more round of applause for our panelists. At the very beginning of the evening, we talked about, again, the importance of our partnerships and working together and the collaborative sense of community to help keep our children safe. And again, I really want to thank all of you. We had over 100 people here tonight, and luckily we had enough cookies. But this really went above and beyond our expectations. So this is just the beginning of conversations that we need to continue to have. And again, thank you, the panelists. Thank you very much for coming out. We really do appreciate it. Have a great night.